welcome to the Bald Ambition Podcast. I'm your bald host, Mookie Spitz, and the one with ambition today is Mr. Dale Cooke. He is president of Philly Cooke Consulting and FDA Ad Law. Welcome aboard, Dale.
Thanks, Spitz. Great seeing you. It's been a while.
It's been a long time. And speaking of Philly, I'm a Chicago native. And we like our Italian, or as we say, Italian beef. So what's up with the cheesesteaks in Philly? Can you quell the rumors? And do you have a favorite there, Geno's or Pat's? Tell all.
Well, so first off, trying to choose a single favorite cheesesteak place is just, it's asking me to choose among my children. It's just not fair. There are a few thousand good ones in the Philadelphia region, and as far as I can tell, exactly zero outside the Philadelphia region. But I'm a Jim's guy at heart, down on South Street, and that's where I find myself returning whenever I need that infusion of, the cheesesteak straight into the veins kind of thing. So, and I do need that, every now and then you just have to. When I think Chicago, though, the Chicago beef, right? I mean, you gotta do that. I'm not so much a deep dish guy, I got to admit, but there's plenty of good food in the Windy City to binge on.
It's not a pizza, it's a casserole, according to Jon Stewart. And I've lived in New York. I just left New York a little while ago. 13 years in New York, and I can kind of relate, but the deep dish Chicago pizza has its own charm, and it is warm and cozy in the Windy City. So thank you so much for joining us. There's a new boss in Washington, and it's same as the old boss, as the Who song goes, but there's some big differences. And I thought I'd bring you on to chit chat a little bit about the FDA, the Food and Drug Administration. You are an expert in healthcare communications, in the regulatory environment surrounding the selling of pharmaceutical and life science products and services. Can you give us a broad overview as to exactly what's going on within this environment where everyone is talking about deregulation, and at the same time, the Doge chainsaw is doing tremendous reductions in force, including the FDA? So it's confusing, it's chaotic, it's uncertain. Can you bring us the certainty of your insights and wisdom and experience in this environment over the past? You've been doing this for quite some time. 15 years, is that right?
I'm approaching 20.
Okay. All right. You're
Yeah.
the right guy. You're the right guy to talk to today. So give us your overview if you can.
Yeah. So, I mean, yes, there have been tremendous changes. I think the Who song here might not be a great, starting point, because this is absolutely not the same as the old boss. What we have seen in the first, as we're recording this, we just passed the milestone of 100 days of the new administration. And what we've seen is a tremendous amount of chaos and a tremendous amount of damage that has been done to the federal government across the board, and to FDA and HHS in particular. I don't think there is anyone on the left, right, center who thought that absolutely every single person who worked for the federal government was an essential employee, and that we needed to keep every single one of those people in place. But the way in which these cuts have occurred have just been chaotic and damaging. I had the experience, for example, of being on the phone with a client just a few weeks ago, and saying to the client, you really need to talk to so and so at the FDA, because he's sort of the world's leading expert on this particular topic that we were discussing, related to the use of AI and certain, ad promo communications and getting that, information out there. And then I paused for a moment and I said, assuming he still works at the FDA, immediately after the meeting, I sent an email, and yeah, turns out he was let go as part of the reduction in force that happened on April 1st. And that's just one tiny example, right? This is, again, one of the world's leading experts on this topic who was fired. Why? Who knows, right? Because they didn't go through and sort of do a surgical, removal of trimming fat. They just took a machete to a bunch of org charts and they cut bone and muscle. So, we have seen real damage done, and it will be difficult, if not impossible, for, some of these organizations to recover from the damage that has been done. The current Secretary of HHS, RFK Jr., has made very clear his complete disdain for the FDA and for everyone who works there. He referred to, in a speech to employees at the FDA, he referred to FDA employees as sock puppets for industry. So clearly he doesn't think, that these people who have dedicated their lives to the public health and who, for the most part, are, taking significantly reduced salaries. Most people who work at the FDA could make a lot more money if they were working in industry. So, they work there because they believe in the FDA's mission of protecting and promoting the public health. But clearly, the current administration and the leadership just doesn't share that attitude. So, the damage that has been done is very real. And, you mentioned that there has been talk of being sort of pro-industry by embracing a, deregulatory track or trend. But what industry really wants from regulation and government is a stable regulatory environment. We want to know what the rules are so that then we can operate. And whatever those given set of rules are, we want to keep them the same, right? Change is expensive, right? Changing, whether you're revamping regulations or you're revoking regulations, any sort of change creates uncertainty and creates risk for industry. And what we have right now is just a tremendous amount of uncertainty. We don't know. We're getting a lot of talk from RFK and the new FDA commissioner about the negatives of advertising and promotion around prescription drugs. And yet, almost a third of the Office of Prescription Drug Promotion, OPDP, was let go. So, are you cracking down on industry ad promo initiatives? How are you doing that when you're getting rid of a significant part of the people who would have done that crackdown? So right now, industry is trying to figure out what this administration is going to do. Are they going to be ramping up enforcement? We haven't seen any enforcement in the month of April, but 1 month doesn't really tell a tale. It's far too limited a time frame. Are we going to see a loosening of the reins? Right. Again, what we want in industry, what industry wants as a whole, is certainty. And so it has been a difficult time. And this particular moment in history, there's a lot going on, right? It's not as if, independent of this change of administration, that, the pharmaceutical industry and others of, FDA regulated products, medical devices, vaccines, etc. It's not as if, the overall environment was static. There's been a lot of change, a lot of innovation going on. And so there was really a need to deal with all of that stuff. And then we've just had additional uncertainty thrown into the mix for no apparent reason.
For a long time, you've been an advocate of simplifying the spaghetti bowl of regulation. Now, specifically, let's zoom in on one example, which was fair balance.
Mm-hmm.
Now, when a drug promotes itself and makes any kind of claim, just for our listeners' edification in broad strokes, it must be balanced with the risks of that treatment. Now, you've been an advocate of the air quote one click rule. So instead of, and I don't want to speak for you, but I'm using this to illustrate that just as devil's advocate, change is difficult, revolution comes at cost. And there might be one perspective that the regulatory environment vis a vis these life enhancing and life extending drugs and treatments has been overly complex and burdened by bureaucracy. So, everything that you said aside about the chaos and turmoil, which is incontestable, uh, might there be a potential benefit in terms of reducing some of the burden of the regulatory framework, even within the lens of some of the work that you've been advocating for years? And I don't mean to, again, create a straw man here or any kind of false equivalence between today's chaos and your work, but is there any method to the madness, and do you see any benefit from clearing house and kind of like starting fresh, if you will?
So I do want to clarify that I've never actually advocated for the one-click rule.
Okay,
I've written pieces about the one-click rule
okay,
to help people understand it, but I've
sure,
never taken that explicit position. Regarding the notion of fair balance, which is written into the regulations as a requirement for pharmaceutical advertisers, I do think that the idea of providing some risk information about prescription products is good. That is a good thing.
sure,
How you do so, making it easier for industry to comply with that regulatory requirement, those are all things I absolutely have advocated for.
okay,
That industry should be trying to provide more actionable, valuable information to consumers. The idea of throwing an entire bathtub filled with risk information at consumers or HCPs is not valuable. It does not help them. It overwhelms them, it confuses them, it makes them feel lost. With regard to whether the deregulatory emphasis of the current group would help with streamlining those, quote, some might call them burdensome regulatory requirements, I don't think so. Because, for example, in a recent interview, the commissioner said that he wants more risks being presented. He wants to look at the information that's being presented in TV ads, for example, and really make sure that there's an emphasis on that information. And he wants to get rid of the happy, smiling people and all of those things from TV ads. So that's part of the confusion is on the one hand, they're saying strip the regulations, let's repeal regulations without telling anybody what we're doing. Let's get rid of the whole rulemaking process of notice and comment. And on the other hand, they're saying, oh, we want to change the rules and we want to ramp them up on pharma to make it harder to get information to people. Well, again, choose a lane, right? Like if you want to ramp things up, you need bodies to do that. If you want to reduce things and get rid of regulations, you need a lot fewer bodies. You still need people, but you don't need as many. So, figure out which way you're going, and then do it, right? But what we're getting right now is conflicting messaging and just chaos with no point. I mean, I think there is a discussion to be had about how pharmaceutical companies provide information to the public, broadly construed to mean, healthcare professionals, HCPs, consumers, caregivers, etc. There's also a conversation to be had about whether the current means is, whether the current regulations are the right regulations, need to be tweaked, changed, etc. But just throwing everything up in the air, I mean, if you want to just get rid of all of these requirements for pharmaceutical companies, okay, then prescription drugs would be advertised the same way, you see foods or, dietary supplements or other things. I don't think that's what the public wants. I don't think that's what, the current administration wants. But that would require repealing a whole bunch of regulations and in some cases changing the law, because some of these things are not merely a matter of what FDA did, it's what Congress did. And no matter what the current administration says, you can't simply ignore Congress.
I think most business leaders would agree with you. The tariff situation, extensive, random, ever changing, chaotic, has thrown Wall Street into a similar tizzy. So, in a sense, the challenges that you're experiencing, FDA, OPDP, are a microcosm of a broader approach, which is slash and burn, bring out the chainsaw, blow it up, and when the smoke clears, let's see what's left and cobble it back together. That seems like a general modus operandi of this administration.
Yeah, and the alleged motives for the destruction are simply lies. So for example, we heard how Doge was going to save us an amazing amount of money through all of these staffing cuts. Well, there was just a report that came out that said actually the cuts that the Doge did will probably wind up costing the federal government more money than they save in terms of headcount reduction, because of things like reduced revenue for the government because you're no longer collecting as many taxes, because of all of the litigation that's been instigated because a lot of the things that were done were illegal and courts have ordered them to be reversed. And of course, that's a cost, right? If the federal government is busy defending its actions in courts, then those attorneys who are doing that are not doing other things. So that's a real cost. So, with regard to tariffs, I'm glad you brought that up. Really interesting for the pharmaceutical industry in particular, because, the pharmaceutical supply chain, as we all learned during the COVID pandemic just a few years ago, is incredibly complicated. And it is a globe spanning network. And there are facilities all over the world that play an essential role in getting the medication that you need or that your loved one needs into your hands. And what's going on right now with the tariffs and some initiatives to to reinstitute domestic manufacturing, it's going to be at best difficult and perhaps even impossible to go back to the network that didn't span the globe. And the reason I say that is, first of all, let's assume you're a pharmaceutical company. And note, pharmaceutical is just one example. It really applies to any industry. And you're considering completely upending all of your supply chain that is currently based in China and India and Ireland and whatever other countries. Okay, so now what you need to know, again, certainty is your friend, uncertainty is your enemy. What you need to know is 5 years from now, will these tariffs still be in place? Because if these tariffs won't be in place in 5 years, it's going to take me a minimum of 5 years to build a new facility, to get the new supply chains up and running, to do all of that stuff. So if we're going to have the tariffs put on a Tuesday, and then the following, Wednesday they're removed, and then they're removed, but we're told, oh, we're taking them back, but they're coming back, and they're going to come back any day now. Well, that's not certainty, right? That's enhancing uncertainty, and I can't make a decision about that type of long-term investment if I know that there will be change. If the only thing that I'm 100% certain of is that whatever is true today will not be true in 90 days, then I can't make an investment that projects out for 5 years or 10 years. So, again, there's absolutely a discussion that was needed about, should we bring more things into the United States, because the pandemic had shown us exactly how vulnerable we were to these global supply chains being disrupted by something like the pandemic. That's absolutely a discussion, and we were seeing industries, not just the pharmaceutical industry, rethinking a lot of those business plans. And starting to do some, onshoring, moving things back to the United States. But the chaotic manner in which these tariffs have been rolled out has really made it just straight up impossible. And so you'll get a bunch of commitments and press conferences and press releases saying, "Oh, we're going to do, whatever, the current administration, says they want us to do, just to get out from the doghouse that they've put us in." But the actual follow through, you're not going to do it unless things aren't going to change. And the only thing we've been guaranteed is that there will not be stability. We will not have certainty under this administration. I don't know how to finish that sentence. I don't know if I should say ever, or I should say
Yeah.
for the foreseeable future. I mean,
Well, let me finish it for you with a couple questions. My first question is to your point about the 5-year runway for bringing manufacturing capability realistically to the States for essential treatments, right? So just yesterday at the White House, the CEOs of virtually all the major pharmaceutical companies were, as Trump himself likes to say, bending the knee. Everyone from AbbVie, Novartis, Eli Lilly. It was a lineup of pharmaceutical CEOs, and they had pledged literally tens of billions of dollars of new investment within the states for manufacturing facilities to facilitate exactly that. So my first question is, we are seeing some change despite the uncertainty. There is action. So I want to have you comment on that. And the other one is, let's tacitly assume that the only certainty is uncertainty. Let's segue into the advice that you would give your clients, pharmaceutical marketers and communicators, as to what actually to do in this chaotic environment. So let's take it one at a time, which is
yeah, let
addressing that pushback that all of this is for naught, and then operate with the tacit assumption that this is going to be a wild wheeling and dealing kind of environment. And how do we deal with the randomness and chaos?
so the first part is, for these specific commitments, I think you're going to see when you dive into the details, I think you're going to see a combination of things. First off, you're going to see some of the things that were already underway. As I talked about, the minute the pandemic disruptions occurred, industry started thinking about what they need to do to not be in that position ever again. And so a lot of stuff was already underway to move some of those things into the United States and other locations, not just the United States. So some of that I think what you're going to see when you dive into the details is, oh, 6 months ago or a year ago or 3 years ago, they had pledged to invest X amount of dollars. Well, let's include those dollars in the amount that we're now saying we're going to just yesterday, thanks to, this administration's actions, we're going to now put that into the United States. So they're padding the numbers. Second, is it a commitment? Is it a promise? Or is it an investment? Because, it's really easy to put out a press release. It's a lot harder to write a check. And so, if when the checks get written and the shovels are in the ground and we're actually seeing those that investment come to fruition, that's when it will matter. The press release, can be changed if the environment changes. Then just because you said you were going to do X, well, we said we were going to do X, but now the environment has changed,
Yeah,
so we're no longer going to do
they're
X.
like executive orders from CEOs. They're not
Something
particularly binding now, are they?
There's absolutely nothing binding about those types of announcements. So that's the first thing in that regard. Again, I don't think that it means nothing. I'm just saying we have to take it with a grain of salt. We have to wait and see what actually comes of it. And again, how much of it was real, genuine, new, incremental, above and beyond what was already planned to be done? I don't know, right? You have to dive in. And my guess is that it's going to differ depending on the specific company that we're talking about. Then the second question regarding how do you deal with uncertainty in general, because we're going to get nothing but uncertainty for the foreseeable future, is, yeah, it's a challenge. You have to move forward. You can't simply remain, in stasis. So you're going to have to do things. You're also going to have to the greatest extent that you can, avoid long-term commitments, because you're going to know that there is this uncertainty and there's going to be a need to pivot. So you're going to tend to pull back on things that simply can't change, right? What I talked about earlier, if there is a change in the regulatory environment, it costs industry money to adjust to that change, even if the change itself is, quote, pro industry or making things easier for industry. Lightening up on things is also expensive, right? Getting rid of review and approval processes is expensive. Teaching, reviewers that they should take a lighter hand, that costs money. So, any change has that cost associated with it. And so to the greatest extent that you can, it's going to be move forward, but be very cautious about making significant investments in things that you can't pull back on. And that is all part of this, why the long-term chaotic environment is damaging. You're not going to create a massive investment in something that is going to take you 4 to 5 years to bring to fruition, if you're just not sure that 4 to 5 years from now you will be dealing with the same factors that make it seem sensible today. And that's across the board, whether that's manufacturing, whether it's investing in new review and approval tools, whether it's new communications technologies, etc. You don't go whole hog into whatever the latest greatest toy is. You and I are old enough, um, no offense intended, but we're old enough
You,
that,
you still have a fine head of hair, Dale.
well, thank you very much, Spitz. And you're looking as youthful as you did on the day you graduated from college.
No
If we're gonna,
doubt.
so you and I both remember that there was a moment where Friendster and Facebook were neck and neck in terms of who was going to be the social media platform of the future. And quite frankly, the smart money at the time was betting on Friendster. right? It looked like they had a larger initial base. They were doing things that made them easier to expand. It looked like they were going to win that race in terms of being the dominant social media platform moving forward. So, at that moment, if you went all in on Friendster, and you put all of your dollars and all of your investments into building out the Friendster initiative that would have made your Friendster applications for communications the industry's gold standard, and it had only taken you 5 years to do that. Okay, well, 5 years later you would have woken up and realized no one is using Friendster anymore. Facebook won that race. In fact, to even refer to it as a race at that point feels kind of silly because they were so far head and shoulders above where Friendster had been that, that most of your audience probably don't even know who Friendster is.
Yeah, MySpace maybe, and we can have a similar analogy to Blockbuster and
Yeah,
Netflix and
absolutely.
Ask Jeeves and Google. So the
The
list goes on where uncertainty precludes long-term planning.
yeah, so
That's the lesson here, right?
the key
Yeah.
is you have to be flexible, right?
Yeah.
In everything that you do, you have to be always thinking about pivoting. And, it doesn't matter where you're going. It doesn't matter what you're thinking of. If you're going to be, dealing with uncertainty, how do you deal with it? You keep moving forward, but you constantly are monitoring the situation, for people in the pharmaceutical industry who are looking at ad promo communications. You're going to be paying attention to who the new head of OPDP will be. You're going to be paying attention to whether that's someone from within FDA or someone from outside FDA. Will they be, will they make any statements criticizing the industry? What is that process going to look like? Um, and there are some terrifying options and there are some reassuring options. I have no clue which direction we're going to head. Um, so for, how am I advising clients? I'm advising clients to move forward, but don't put all of their eggs in any given basket. And, there's a lot of stuff that people need to move forward on right now.
Let's settle in on a few certainties within this chaotic jungle of an environment. Eddie Van Halen, the guitar playing virtuoso, had a terrific expression. He said, "Fall down the stairs and land on your feet." He referred to his guitar solo pyrotechnics that way. As long as he landed on a note that was in the key of the song, he felt he was okay. So, given the madness that's going on in healthcare, communications, in the regulatory environment, within your space, can we share with the audience a few pieces of guidance that have come down the pike since Trump that we could at least hang our hat on? You were intimating that there was one piece of guidance about that fair balance, the risk information not being obfuscated by bouncing babies and smiling mommies. That's one. And I do believe that there's another piece of guidance specifically referring to the use of artificial intelligence in the creation or administration of this kind of information. Can you illuminate me and the audience as to at least the nuts and bolts of guidance that is at least mandated? So at least we could take steps in terms of creating that ad and putting it on Facebook or Google.
Yeah, the core regulations have not changed.
Okay,
And,
that's an important point just for our audience to understand. Whether you're an expert in healthcare communications or not, it's not complete chaos right now. The laws are still the laws, the guidance is still the guidance. Looking forward, it's like, whoa, wait a second. But if you are in the process of creating advertising or partnering with an influencer in social media, there are stipulations that you need to honor, that you could train your staff and you could create content which is compliant at this moment. Correct?
Yeah, absolutely.
Okay. All right. I just want to
The
give them the assurance that now that Trump is here, it's not, complete chaos.
I caveat everything with as of this moment in time when we are speaking,
All
because
right. All right.
because the environment we're dealing with is one where 2 hours from now a statement might come out that changes all of this. So I
Right.
don't I that's the massive uncertainty. But
Sure.
as we are recording this session,
But there are
Spitz,
agencies creating content. There are pharmaceutical clients who are trying to build
right?
awareness and educate healthcare professionals and
Yep,
empower caregivers. And we have our audiences, Dale. We have
yep,
our treatments, and the machine of the engine of the pharmaceutical industry, life science companies, continues to grind forward. So what do we do?
absolutely.
What do we do?
And what you do is you create good content. You create
Okay.
good content that communicates the information that people need to make informed decisions about their healthcare and or their loved ones' healthcare. The only significant change to the regulatory environment in the past 10 years is the new CCN rule regarding the clear, conspicuous, and neutral presentation of risk information in TV ads. That is the only new regulation that we have had in a very long time. We have gotten guidances from the agency. In fact, we've gotten quite a lot of guidances from the agency in the past year to 18 months. But again, guidance represents the agency view. And when the agency has had such a radical overturning, will those guidances be withdrawn tomorrow? Beats me. I don't know. It wouldn't surprise me if they were. It also wouldn't surprise me if they just remain on the books. So we will see what happens with regard to a lot of these types of issues. What do you do moving forward? Right now, you create good content, right? You give people the information they need. And you also have to remember that in our environment, the all of these things that you do tend to have long tails. You don't just create a an Instagram post and 6 months later it's forgotten about and nobody thinks about it ever again. That post that went out on TikTok, Instagram, whatever platform you choose, could wind up being used in a court of law in 10 years, being presented to a jury as, an inappropriate communication from your company. And that is a very real risk that always exists. So, you have to move forward, but, so long as what you're doing is abiding by those core principles of giving good information, following the regulations as they are written and as they are on the books today to the best you possibly can, then you should feel confident in continuing to develop communications.
So I'm hearing an implicit recommendation, which is err on the side of caution. So even though consumers are intaking a tsunami of information on their phones in real time, any ad that's placed, regardless of channel or modality or medium, is a potential problem for you, is what you're saying. So be aware that despite the chaos and these shifting regulatory situations, stay true to your mission as a healthcare life sciences company. Provide healthcare professionals, patients, caregivers with accurate information to help them make informed decisions. and respect the essence of healthcare communications, which is maintaining that fair balance. You make a claim, share the risks, and abide by the general principles of the law, which is more or less self evident and hasn't changed essentially in over a decade. Is that reasonable to assume?
Yeah, follow the law always, right?
Yeah,
If the
that's a given, but do it in a way where I think what you're saying, and please correct me if I'm misrepresenting that, even and especially because today's environment is so chaotic and uncertain, stick to your guns about maintaining that benchmark of what we would consider compliance.
Yeah, absolutely. Under no circumstances would I advise any client
Okay, right,
to engage in communications that they are not completely confident are compliant, right? So you said err on the side of caution. I'd say err on the side of compliance, right?
right,
You you if you're looking at a communication and you're thinking, gee, I'm not really sure if this meets the regs, well then don't do it, right?
yeah, yeah,
Make sure it meets the regs,
and
period.
the regs are clear at this point. At this point, in this
Yeah,
moment of time, the regs, the foundational regulatory environment is consistent.
at this moment, right?
Okay, good.
Again,
Again,
there
I don't mean to flog that horse, but hearing you speak is conveying from an industry expert a sense of not panic, but a sense of consternation and frustration that the ground beneath our feet is unstable, which it is.
it
But I just
is.
wanted to.
And the reason I'm conveying that is because it
Right,
is. Because
right,
and I don't want to beat this dead horse either, but as of this moment, as we speak, here's where things stand. But an hour from now, I don't know. And I don't know precisely because there have been, intentional efforts to make clear that we will not know what's going to happen tomorrow, right? When you have initiatives put forth to say we're going to just repeal regulations and not even follow the notice and comment procedure established in law for doing so, well, that's really scary. you know what we want is certainty. We live in a world of uncertainty. My advice to clients is right now, as we speak, we know exactly what the rules are. We need to
right,
follow them.
right.
Will those rules be true? Will those still, same principles apply, going into the future? I don't know. That's why you need to constantly be monitoring the situation and you need to be prepared to pivot. But, right now we know what's going on and we know what we need to do.
And on the other side of the equation is enforcement. So we're reading about daily reductions in force at the
Mhm.
FDA. I believe 3,500 employees were let go from the Food and Drug Administration. There's been similar reductions at OPDP and other government bodies related to what we do in healthcare marketing communications. So, much like the IRS being gutted, it calls into question the capacity of the government to generate its own revenue. If you're trying to reduce the deficit, it behooves you to perhaps maintain a viable and effective internal revenue service. And similarly, here, if you're trying to maintain public health through a well enforced regulatory body, then it begs the question of eliminating all of these positions. But eliminated they are. And that, I believe, adds complexity and confusion to the mix, which is where's the cop should a brawl even break out?
Yeah. Again, these cuts were not done with, a precision notion or vision for what would the things would look like in the future. So, um, I I don't know what we're looking at in terms of an enforcement environment. That's the mixed messaging that I alluded to earlier, right? On the one hand, we're being told, oh, we're coming after you, pharma. On the other hand, the people who would do that coming after you have been fired. So, I don't know, but right now, just stay the course in terms of obeying the rules as written, and that will always, there's never going to be a case where you go up before a jury and say, well, we followed the law exactly as it was written, and you're still worried, right? So long as you're doing what's right, you're going to be okay.
100%. And I think that's the big takeaway is that yes, we live in uncertain times. Yes, the environment is chaotic. Guidance, regulations can change out beneath our feet, but the regulations that do exist now are clearly defined. And if there's any ambiguity about their implementation or application, this is what I heard for years working in the healthcare communications industry. Call Dale.
Sure.
Whether it was a boardroom or a conference room, a strategy session, or even a tactical layout of a multi-channel pharma campaign, someone in the room would shout out, "Let's call Dale!" And that
Well,
call, it was like the bat signal for
right.
compliance in the industry. Can you share with listeners briefly the why me and my peers for years in healthcare marketing would ignite the bat signal? Why we would exclaim, "Call Dale"? What do you bring to the organization that many other
Sure.
folks
So,
appreciate and don't?
So the elevator pitch for me and my services has remained the same always, and that is, I help companies use 21st century technology while remaining compliant with regulations written in the 1960s, because those core regulations that we have to comply with. Again, we had the CCN rule that's a brand new one, but for the most part, those regulations were written long before any of these new platforms were developed. And that means that it can be a challenge to apply those regulations to the new environments. And that's why, people would, pick up the phone or send me an email, because that's what they're trying to do. And that's as true today as it was, when I first got into this industry. The specific things that we're doing have changed and evolved. So I don't see the phone ring nearly as much about somebody who is saying, gee, we want to do, a Facebook post. But now it's about the use of AI in communications, right? So there will always be this ever changing, ever evolving communications landscape. And we don't want, as I said before, right? Industry wants stability. We don't want FDA producing brand new regulations every 5 weeks to deal with the latest platform that came out from, some person in their garage. We want that stable regulatory environment, and then we figure out how to do it. And that's what we're going to be faced with. This is the really exciting time, and that's what I alluded to at the very beginning of our conversation, that even if nothing were happening at the administration, there has been so much changing and evolving in the communications landscape that we are having as an industry to figure out how to address these new topics. Um, what is the role of AI in the review and approval process? I'm working with several companies on helping them, uh, develop tools and use these technologies to improve their efficiency. What is the role of AI in the development of communications? Right? I teach ad promo at Temple University in the law school. And for my students this semester on the final exam, I gave them an AI generated image to see whether they would pick up on, the fact that this image was generated by AI. And is the mere disclosure of the fact that the image was generated by AI sufficient? Did the AI generated image, comply with the relevant regulations? The fact that it's generated by AI in some cases sort of doesn't matter, except of course it meant the fact that I could create the image here going on. I don't remember what I used, whether it was Google Gemini or ChatGPT or which engine to generate the image. But I just, I was able to generate that image. I think I generated like 10 of them to get the one I wanted. So it took me like
Yeah.
15 minutes
Yeah,
versus
but that would take an agency sometimes weeks. I remember back in the day,
absolutely.
we would have creative, which was an analog image of an actual patient or caregiver, and then it was out of indication. This person is too old for the label. This person
Exactly.
is too young, and now you just do a different prompt on your gizmo, and then you get the right looking patient, right?
And that's the thing,
Yeah,
right? Those
yeah,
efficiencies, right? In 15 minutes, I was able to generate
right,
imagery that at a bare minimum would have taken weeks and possibly
right.
months for,
Absolutely.
to generate in that
Yeah.
previous world. So,
Yeah.
I'm not poo-pooing these technologies at all, right? I'm saying, my goodness, aren't those, efficiencies astonishing? Aren't they incredible? But we have to make sure that we're using them in ways that remain compliant, right?
Yeah.
It's
And you need to
first,
plug
last,
in a
and
sense, your expertise. One of my
yeah.
prior guests a couple weeks ago on the show here was a co founder of 3 Cubed AI, and she is using AI to generate compliant ads. You put in the core content, it algorithmically it does the Dale. And it pumps it out. Now, I don't think that that'll make your role and Philly Cook's role superfluous. You're always going to need that human oversight, I believe, to make sure that it's compliant. But algorithmically instituting and maintaining and monitoring guidance and a regulatory framework that has been with us since 1960 seems like something a machine could do and could do it well. So, that could be a harbinger of things to come. Perhaps most significantly, though, let's look at the future just for a second. And I find this fascinating. I'm using ChatGPT and the bots more and more to the point where I'm almost circumventing conventional search engines because now the bots have search capabilities. When ChatGPT initially launched in November of 2022, it was using year and a half old data because the original LLMs were trained laboriously. Now you have the new NVIDIA chips, and you've got hundreds of billions of parameters. And now, thanks to DeepSeek and other companies, you can actually have an LLM parked on your own laptop. The technology is exponentially accelerating.
Mhm.
So let's look at a future where people aren't really Googling, but they're going to a bot for their health information. And recently, I took a plummet on my bike. I had a mild hematoma that I self-diagnosed, and I was kind of a mess. But ChatGPT made me feel a little bit better. And it didn't go so far as to prescribe any medications. Bing, bing, bing. You see where I'm going with this. But it played doctor for me. I avoided an emergency room visit, and perhaps that was a foolish thing to do. But I did my Chat GPT search, and it was my medical assistant. And I applied ICE, and I was a lot less worried after I did my query than before. So we see where this is going, Dale, which is, the idea of finding pharmaceutical ad placements contextually using Google or Bing, being taken to a website where you might have a banner advertisement, where you see an influencer yakking away on Instagram. Those days are morphing into an AI bot reality where we're all going to have our personal bots. And this is going to be a lawyer bot and a counselor bot and a girlfriend bot and a doctor bot. So how is what you do and what you've been advising now for decades potentially going to influence how healthcare life sciences companies are going to adapt to placing claims on a dynamic AI experience. I mean, to me, this is the most fascinating and most obvious and inevitable evolution of the technology. And given the chaos we're in right now, to your point, we are adding to that chaos. Let's say, a different administration would have won, and everything is just kind of like on course the way it was before. That aside, the technological environment is wild. What now?
Yeah. So right now, as things stand, and for the foreseeable future, the key is going to be maintaining, and you alluded to this in your setup, maintaining that human in the loop, right? So-called human in the loop. Now, I just saw a story this morning on Stat News, um, and I'm not sure whether it came out today or yesterday, that a lot of physicians who are using some of these AI tools didn't catch that the AI was wrong. And so, getting better training for everyone involved to understand what their role is, right? That we're using the technology and, we're not simply accepting the results and figuring out what that looks like. I mean, we don't want to, that was one of the really terrifying things when this initial AI explosion took place, was some of the stories about um, healthcare systems implementing AI without any checks on them. They were just like, oh my God, the efficiency gains are going to be so amazing. We've got to
Right.
roll this out immediately. And the answer is, well, no. Right. I'm not saying no technology. I'm not saying don't go dive into this pool. What I am saying is, as you were talking about earlier, you need to learn how to query. You need to learn how to, make the most of these tools, what your check needs to be, not simply accepting it. I use, these AI engines all the time as I'm doing my job, as a leaping off point, as a start of my research, my endeavor. I would never, and I assume you're in exactly the same boat. I would never simply type into one of these engines, give me a letter to a client, or a memo for a client, or a brief for a court, and then copy and paste the result and submit it, right? Like, that's not going to help. But will it help as a search engine to summarize the law on a given point and provide the link to the actual statute and to some of
Yeah.
the cases that and will it be far more effective than just going to, I don't even know what the term should be. We need to come up with a retronym for old-fashioned search engines like google.com, of like, where all I would get would be those links without getting that additional
I think
summary.
just we got Googled, and now we're being
Yeah,
botted. We're being botted, right? It's such a
something.
huge change. But the internet itself is going to change, because why do you need websites at all after a while? Everyone will just be pumping the data right into the bots, which leads me to my final question: that can the bots maintain fair balance? I'm assuming they can be programmed to do so. So that if it comes to the point of making recommendations for treatment options, then to do it within DTC constraints.
Well, so the bots themselves, their output currently is not regulated by the
That's my
FDA.
point. Right. That's where I'm
So,
headed. Right. Right.
whether the people who own the bots and who, implement them, choose on their own to constrain the bots by doing something like saying the bot's output must be compliant with FDA regulations, that would be a decision by, ChatGPT, by Google, by DeepSeek, etc. They would have to voluntarily do that. I
Unless the government
seriously doubt.
mandates it. Unless the government mandates it. It's a
Right.
communication channel. So I
But that
guess
would be
that's
a massive change in law, right? To
right. And
suddenly
that's
do
where I'm
that.
headed,
And
which
it
is
would
which is
we'll,
yeah.
we'll see.
Right.
I no one is talking about that aside from you bringing it up now.
Well,
Could
I
that
think it's
happen?
the
Could.
question, Dale. That is the question. Everyone's botting, and we're
Yes.
reaching the point where more people are going to bot than search, and that'll make all of our efforts superfluous because if you can't regulate the bots like you're regulating the rest of the web, then it begs the question of any kind of enforcement of fair balance of all the things we've been talking about since 1960.
Well, we will see. I don't think, and maybe I'm, being naive here, but I don't think that the bots are going to completely replace all other sources of information. I think that they will remain for the foreseeable future an important supplement to the other sources. And in that regard, why do pharmaceutical companies create communications about their products? Well, because the pharmaceutical companies at the moment are still the most authoritative source for information about their
Right.
own products, right?
Right.
Bar
So
none.
what if
I
no
don't care
one's
what your
going to
bot
their
says.
website? No one
Well,
goes to pharma sites anymore because they're all botting, including the healthcare professional. I'm time stamping this May 1st, 2025. Mookie Spitz says that search and websites will be no more. And to Dale's point, it won't be tomorrow, but that's coming. That's inevitable. It's going to be a bot driven internet. And then what? Ta-da! You know what?
yes.
They'll have to call Dale. The bots will have to call Dale. This is an alert to OpenAI and Grok and Claude. Call Dale, folks.
Yeah. So we will see how this develops. And again,
Yeah,
this is we're alive at a absolutely an inflection
yeah,
point, and I am really excited to see how things develop. I think I'm not convinced that all of the changes that are about to happen are good, but I'm also not convinced that that we're headed down a doomsday scenario.
yeah,
I certainly hope that science fiction turns out to be wrong and that Skynet does not, choose that
yeah.
decide that human beings are superfluous. But we will see, right?
I think our superfluous future is inevitable, but the question is how they're going to deal with us. Are they just going to wander off into the universe like Scarlett Johansson did in Her, or are they going to just mimic us or annihilate us? I think that's the real question. Eventually, we'll
Yeah.
just be these flesh buckets of boring, boring, slow cognition.
Oh goodness. My goodness, Spitz. That's a real bummer to end this conversation on.
I'm hopeful
I am
until
more
then.
optimistic. I am
Yeah.
more optimistic that first of all, again, I don't know. We're not talking about next week. We're not talking about
No.
next quarter. So we're looking out a decade, 2 decades from now. And when you make those sorts of projections, it just gets hard,
A
right?
hundred percent.
There
Yeah.
was a story I saw just recently about a projection for AT&T about cell phone usage, and AT&T initially chose to get out of the cell phone business because their projection was that a few 100,000 cell phones would exist by the year 1990 or 2000. Of course, that projection turned out to be massively erroneous, and they paid the consequences for it. And when we're looking at this sort of transformational technology, we can certainly know some things about what's going to happen, such as it will become more ubiquitous, it will become more essential. I think the idea of in 2 to 3 years, the idea of doing work without the use of AI will seem somewhat archaic. But will we become mere flesh buckets of slow cognition? Certainly not in that time frame.
Probably not. Maybe eventually. So anyway, thank you for making time, Dale Cook.
Always a pleasure, Spitz.
Yeah, it's been great. And maybe we could follow up in 6 months or a year and see if the circumstances are a little bit less chaotic than they are now. Thank you,
I look
Dale.
forward to it.